My first question, what's the update on the COVID-19 vaccine that has been found in Taita Taveta? Could you kindly comment on that? And is there...
Okay, second question. I'll let...
You rightly put it that our positivity rate is significantly low despite the opening of schools and all. And
to appreciate your support, especially during these times of a visit like this, the impact of which can be very important to our people, particularly in the health sector, and we appreciate that you are assisting us to make this known, not just in Kenya, but across the world. I'll be taking a few questions regarding the matter at hand, but in addition to that, of course, is that I would like to take this opportunity to also inform you of the days, the situation with COVID-19 in our nation. And today, out of 136 people, 136 people have tested positive to the disease out of a sample size of 3,787. That means that our positivity rate is still below 5%. This is a good sign, and we are hoping and praying that this is something that is going to continue. We were waiting to see whether post-Christmas holidays, post the opening of schools, we are going to have an unusual spike. But I think we are still holding fort. Thank you to the students who have gone back to school with a lot of discipline. There is clear hand washing, students are wearing masks, teachers are wearing masks, and there is strict observance of the measures that we have proposed and the protocols that we have given to the Ministry of Education. We are impressed by what we are seeing, and we hope that this is something that is going to continue. We have already been in school now for the last 2 weeks, and so far, so good. As you know, we reported that we had a case which had, in one of the schools in Nairobi, we isolated the child and tested the entire school, and I'm glad to report that everybody was negative. So far so good, and we are keeping our fingers crossed that this is something that is going to continue. So you will be given the details of what has happened today and what has transpired. We can also report that currently we have got some 686 patients who have been admitted to various health facilities across the country. We have got also an additional 1,625 persons who are on the program of home-based isolation and care. We have 30 patients in intensive care units, 14 of whom are on ventilatory support, and 14 are on supplementary oxygen. And 2 we are just observing to see how it will play out. There is also another 11 patients who are separately on supplementary oxygen, with 10 of them in general wards, while one is on high dependency units. In terms of the areas of concern, Nairobi, as you know, still remains our main infectious area, but even then, it is well contained. Unfortunately, we have lost 2 patients today, and therefore pushing our cumulative total to 1,736 deaths to date in this republic. So I once again want to sincerely condole the families of those who have lost their loved ones, and we keep praying and hoping that COVID deaths are something that is going to be in the past tense soon, rather than simply announcing every day. So we condole the families, and we'll keep them in our prayers. I would like to take 1 or 2 questions, and then we call it a day.
What is important to say is that we are well on course in terms of having the vaccine in the country. And indeed, this morning we had a meeting with stakeholders, just going through the overview of our...
I'll answer some of the questions. I'll let the PS weigh in on something, and then Dr. Amoth We'll also we'll answer some of the technical areas. Fortunately for us today, we are in the middle of the knowledge den. So if we don't know something, we can always call on our professors here to respond to the issues of variants and so on. But on the matter of the positivity rate, to begin with, Anita, let me say this. Under normal circumstances, and according to WHO standards, when you have tested below 5% for the kind of period that we have, normally you would consider yourself as on the way of at least having flattened the curve. However, as I've repeated in the past, we have maintained higher surveillance than would be normal, because some of the measures we have taken, especially the opening of the schools, are pretty heavy events. And we do not want to start declaring ourselves having flattened the curve and then immediately start going backwards. We also keep observance of what is happening across the globe, what is happening in the region, and therefore before you declare yourself as having come out of it, you must be aware of your region and what's going on, and the possibility that what is happening out there can also happen to yourselves. That's one. The second thing is to say that we are also aware, and I think this alludes also to the previous question, that some of the reasons why this is happening are because of the measures that are in place. For instance, you mentioned the issue of the curfew. We believe that the curfew has got a very huge impact because of the fact that the interaction and socializing post hours when people become indisciplined is at a minimum level in the country. So we believe that that has also got its impact, and we like to keep it that way, for the time being. So we are not going to ease any measures right now, because we believe that the situation is still fluid, and until we are certain about certain developments, then we cannot do that. We cannot open up. Moving forward, I think that answers the question of moving forward. We intend to keep the current measures that are there. We intend to keep on a very high level of surveillance. We also want to embark on sero-surveillance to find out, and this institution is going to be key to the way we want to go forward, particularly to test our people and find out how many of us would probably have had COVID and not known about it, and therefore we can tell what levels of herd immunity we have developed. The reason why this is so important is because even as we embark on the vaccines, it is good to know from where we are starting. The whole idea of vaccinating is to develop immunity, to develop herd immunity. And you like to know where are we even as we are starting with the vaccines. The committee that is in place dealing with the vaccines had a meeting even this morning, looking at the logistics, looking at the distribution, looking at the training, on all the issues that you are raising. I think it is important for us to keep in mind that the African countries, especially where we live in Kenya, the matters of vaccinating are very, very common with us. We carry out children vaccination almost throughout the year. So unlike some countries that don't have a vaccination programs, we do have that. So in terms of the personnel, in terms of the logistics of doing so, I think we are pretty ready to carry it out. In terms of the timing of the arrival of the vaccines, I think I'm going to let my colleagues tell you about all that, because I wasn't in this morning's meeting. They were there and they can talk to it. And as far as the variants, I want to get Dr. Amoth will talk about that and the various variants. But I do know, and I think if I tell you, maybe you and I can understand each other better than these doctors telling us, because they are going to start on words that... What I do know and what I have learned from my basic understanding of viruses is that the issue of variants and changing and mutating of viruses is normal, and it happens all the time continuously. And one of the reasons why when everybody was closing the borders and we didn't is because perhaps our professors with a better understanding of this advised us to simply keep watching and hold our breath until we are sure that the variant that we are talking about has got a negative impact on our people. Because variants come, some can go stronger, but usually they go weaker. They become weaker. So let me let my colleague, the PS, just talk about the preparation we have got, and then I will ask Dr. Amoth to weigh in on variants and the scientific.
Had a meeting with various stakeholders, just going through the plan that is already been put in place by the ministry. It's important to also know that just as late as last week, we got a confirmation about the allocation of vaccines to Kenya on the AU platform, that's the African Union platform. We also now have clarity on the allocation of vaccines through the Gavi platform. And so in terms of mobilizing resources, we've also got assurance and confirmation that we are going to get funding through the World Bank for the vaccines. So with all the plans now, moving to address the issues that you have raised, the logistical planning, the training of healthcare workers, the communication that needs to go along that, we are looking at being ready as a country by around April. But again, leveraging on our existing infrastructure that the minister has just talked about, it is also possible that we may have the vaccine even sooner in the country. But we are well positioned right now, and we should all be comfortable to know that the vaccine will be in Kenya very soon. Thank you very much.
Very clearly in a very simple language that viruses or other pathogens will always continue to mutate in order to continue surviving. Indeed, you have reported 2 cases of the South African variant of the virus that was picked by a team in Kemri Kilifi. We all know that this variant is 50% more transmissible, therefore posing a significant risk in that more people will be infected and therefore could be able to stretch the healthcare system more. This was picked because of our heightened surveillance system. These 2 gentlemen have since gone back to their country. At the point of picking them, they were all asymptomatic. And of good note, again, coming from the scientific world, is that even though the variant is more transmissible, it is not more virulent than the novel COVID-19. It can also still be picked by the routine gold standard diagnostic method for COVID-19, the PCR. And evidence emerging today from US is that the vaccines could be effective against this virus, especially the Pfizer-BioNTech vaccine. So viruses will undergo transformation in order to make them more virulent sometimes, less virulent, or sometimes the transformation is neutral, or sometimes is of a non-significance. So what we are doing is to put into place a heightened sense of surveillance to be able to pick, because already there's also a 3rd one from Brazil. So we'll be able to put into place measures that can quickly be able to pick these specimens, analyze them, to be able to guide our intervention measures going forward. Thank you.